Remember, diabetes isn't just about sugar. It affects your heart, kidneys, eyes, and mind.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
A splendiferous Q afternoon to all the Q family listening to 100.7 QFM right now. It's time for 15 diabetic friendly minutes, all with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center. This is Peter Boyce here, and I hope you all are feeling splendiferous today because we have so much things to celebrate in November.
So what we got to celebrate, so?
Barbados has celebrated 59 years of independence this month. So all we Bajans should be proud. And another reason to celebrate that is especially germane to the Diabetes Foundation and the Maria Holder Diabetes Center is November is Diabetes Awareness Month! Yay! And the theme this year is dedicated to raising awareness, promoting prevention, and supporting people living with diabetes. And that is exactly what the Maria Holder Diabetes Center, located in Warren, St. Michael, does to keep everyone living with diabetes and pre-diabetes happy and healthy. But you might be asking yourself,
exactly what activities are the Maria Holder Diabetes Center participating in for Diabetes Awareness Month?
Miss Hillary Ford, Marketing Assistant with the Diabetes Foundation, will come in and tell we.
In the month of November, we make ourselves an extremely busy bee as an organization. Starting this Thursday, we will be at BARP's headquarters in Hastings. That will be every Thursday between the hours of 9 to 2. We'll be offering diabetes screening, diabetic foot screening, and eye screening services. So if anybody is on their way to BARP, they can come in, they can walk in, or they can book an appointment to be seen on time. Every Thursday in November, we will be at BARP. This is the third year we'll be doing it actually. So those who know. We will also be having our annual Oscar Jordan Symposium in partnership with UE. That is also this Thursday at 3Ws. We would advise any medical professional who's interested to come on down and enjoy the lecture. We are also going to be participating in the COB Know Your Numbers Walk, and that is the 9th. We're also going to be participating in the Nations Fanathlon, and that is November 23rd. We will also be in Golden Square November 15th with Republic Bank. So we make ourselves very visible to the community in November.
So I hope all the Q listeners out there hear all of those activities that are happening for Diabetes Awareness Month. But don't worry, we can be reminding you every week on this radio station, so make sure and listen. So tomorrow on your way to Q, you can stop in at the BARP headquarters in Hastings for that free non-urgent medical clinic from 8 a.m. to 12 p.m. Then you could go down to Q. Good. And then there's that big health event that's happening this Sunday, the 9th of November. When you finish eating your Sunday food, you should get ready and go to this.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Do you know your numbers? Because I know my numbers, and we are supporting the Know Your Numbers 5K on November the 9th. 9, that's the number. 3, that's the number. That's 3 o'clock. That's what time you're supposed to get over there to Manor Lodge as you run all the way from Manor Lodge down to Jubilee Gardens in support of the Diabetes and Hypertension Association of Barbados. Come on now, 9, November the 9th, 3 o'clock for the Know Your Numbers 5K. See you there.
So we will see you at the Know Your Numbers 5K Walk, Run, Ride, and Skate coming off this Sunday. Make sure and get your t-shirt today. Good. Now it is time on QFM for us to talk about your health. It is Diabetes Month. Last week, Wednesday, was World Stroke Day. Well, diabetes specialist Dr. Diane Braffett will now make her splendiferous entrance where she will deal with both of those topics like only she can. Happy November, Dr. D.
happy November from myself and those of us at the Barbados Diabetes Foundation. Well, what does November bring? It brings Independence Month. Yes, that's for sure. But it also brings Diabetes Month. And we are going to be very busy this month. And I want to encourage everyone out there listening to stay plugged in to this radio show and also all the other programming, all the other educational opportunities, our Facebook page and our Instagram page, as we share some of those happenings throughout the month so that you don't miss out. Remember, diabetes affects all of us in some way or another in Barbados. However, something important happened, or I should say an important international day was commemorated, and that was World Stroke Day. The theme was every minute counts. Another way to think about it is every minute loss is brain time that's being lost. So first of all, what is a stroke? A stroke is more like the physical manifestation of the brain not getting enough blood for whatever reason. So there are two types of strokes that you want to know about. The most common type is called the ischemic stroke, and that is when the blood flow doesn't go to a part of the brain because the blood supply has been cut off, usually by a clot, and in less common causes may be inflammation. And then we have the less common cause, which is the hemorrhagic stroke, where you have primarily bleeding that occurs into the brain, and it happens through those specific arteries that supply a part of the brain. Now remember that the brain is awfully complex, and so therefore it means different parts of the brain have different functions. So therefore, if you interrupt the blood supply to a part of the brain that has a specific function, it makes sense to deduce that part of the body may not work as it's supposed to. So what are some of the common symptoms of a stroke that you need to be aware of? Usually a sudden onset or a staggering onset of numbness or weakness, especially if it's happening in one side of the body or in one limb. Acute confusion, if there is difficulty speaking, difficulty walking, severe acute onset of dizziness, and in some cases, sudden severe onset of headache. Some people will be used to maybe hearing, I think she might be having a stroke, her face drooping, or something falling out her mouth, right? So all of those are kind of symptoms of stroke that you should be aware of. So if something like that is happening to yourself or someone you know and you feel uncertain in any way, please initiate that fast trot to get some medical advice or to get seen as quickly as possible. But remember, as we said, brain is time. So if you suspect you're having a stroke or someone else, please find yourself at the nearest emergency clinic so that the appropriate evaluation and investigations can be done so as to speed track your treatment. What are some of the risk factors for stroke? Well, a lot of our common non-communicable diseases, such as high blood pressure and hypertension, is probably the most what we call treatable and reversible cause of stroke. Diabetes, if you're living with uncontrolled high cholesterol, if you have a smoking history, whether that's nicotine or marijuana, certainly illicit drug use, unhealthy diets, physical inactivity, obesity, if you have something called sleep apnea, and of course if you have conditions which raise the risk of vascular disease throughout the body, such as peripheral artery disease or coronary artery disease. There is also a condition called atrial fibrillation, whereby the heart beats irregularly, which also increases the risk of stroke, and sickle cell disease, which Black people are more prone to. Some people may not recognize that stroke is actually more common in women, and unfortunately women do have a more adverse outcome when it comes to having strokes. Also, the stroke risk increases in a woman during pregnancy and when she reaches that menopausal state because of the changes in the hormone and hence the change in the stickiness of the blood, etc. Strokes are also more common if you have a family history of stroke, if you're Black, we mentioned if you're female, and obviously if you've had a prior stroke or a prior transient ischemic attack. And what is a transient ischemic attack? We call it a TIA, and this is when somebody has stroke-like symptoms, but they tend to be short-lived, not as long-lived as a stroke, or they may be fluctuating throughout a 24-hour period. However, generally speaking, once your symptoms last more than 24 hours, there is a very high probability that you may have had a stroke. We encourage everybody to seek medical attention if they have concerns, because you may need a CAT scan to visualize the brain. Not may need, you do need a CAT scan to visualize the brain, and then decisions will be made as to the best treatment depending on the time frame in which you're presented and what medications may be safe for you to use. So don't get caught out, know the symptoms, and make sure that you put prevention high on the list. And if you're living with any of the risk factors, which are modifiable or controllable, make sure that you have them addressed. And for those in our community living with diabetes, make sure that your diabetes is well controlled. Remember, it's not just having an NCD, but having an NCD that's poorly controlled that raises your risk many times more compared to the person who may have the same condition but is controlled. Also, if you've been prescribed medication to reduce your risk of stroke, please don't just stop it. If you have concerns with the medication, we always advise you to discuss it with your health care provider before making independent decisions about its usage or non-usage, because suddenly stopping that medication could actually predispose you to a recurrent stroke. So thank you for listening to me. Let's all be stroke aware and let's keep ourselves healthy. And don't forget, Diabetes Month. Join us on all the programming, join the other organizations and all the programming to come, and let's try to be healthier, happier, and more at peace together.
As we go from Dr. Diane Bradford reminding us to be more at peace together, straight into our Q song of the day. As we celebrate Diabetes Awareness Month and Independence, we go to our own Bijan Edwin and Crossfire, taking us down the road with this peace song. Compliments the Maria Holder Diabetes Center.
Show me a peace sign. 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 Let me go. We don't want that. We don't like that. We don't play that at all. In this session, in the region, we must keep standing tall. If I must stand big up, just pick up your rag and smile and come. Let me go. Listen, I just want to let go.
Happy November from myself and those of us at the Barbados Diabetes Foundation.
I just want to let go my show. Listen, West Indian bossy, West Indian bossy. Tell me how we feeling. Tell me how we feeling. West Indian bossy, West Indian bossy. Tell me now where we go. Tell me now where we go.
The Maria Holder Diabetes Center.
We now welcome to the show a patient of the Maria Holder Diabetes Center, Kyle.
Hi, good morning, Peter.
You have been attending the Maria Holder Diabetes Center. How has that helped you?
It's a very personal type of medical facility, or it's not a typical type of like doctor's office, is what I mean to say. It's almost like family. They always call you to remind you of your checkups. The doctors are very helpful, and it's a place that if you go there and they realize, okay, well, hold on, you have some issues with your nutrition or your diet, then they can send you to a nutritionist that is also there. So it's kind of a one-stop shop for treatment of diabetes and hypertension. So I would advise anyone that is affected by diabetes to consider going there for treatment.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-ICE 243-3937 for more information.
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
The Maria Holder Diabetes Center,